Hello, this is Dr. Arti Kandolkar. I am a consultant psychologist and a counselor. Today, we are going to discuss on anxiety disorders, like what is anxiety disorder, what are the different forms of anxiety. You can also say there are different types of anxiety disorders. So we are going to cover types as well. Okay, some symptoms which are psychological, emotional, or you can say even physical. So this is what our entire topic is for today. Okay, so let's begin with understanding what is anxiety disorder, types and symptoms. So let's begin. So we'll study initially what is anxiety and an introduction to it and types. Next, we have seen the types, right? We'll be discussing about this, but now we'll see the definition of anxiety. Now there are a variety of definitions available on different sites and different books. Okay, so we have just picked up one among them, and this generally goes with the APA, that is American Psychological Association. So it says anxiety is an emotion. Okay, so it's an emotion characterized by feeling of tension. So feeling is also there. Worried thoughts, so thought is also covered, and physical changes like increased blood pressure. So what is anxiety? So anxiety covers almost every part, and you can say every structure of human being, that is emotions, feelings, thoughts, and you can say physical changes also. So it is affecting our entire physique, okay, internally and externally as well. So next, after seeing the types and the definition, let's move on to the introduction of anxiety disorder. Now, what is there in an introduction? So introduction will cover some points which will focus on anxiety and related concepts like fear. Okay, so let's begin. It says anxiety is a commonest psychiatric symptom. Okay, so that means it's a very common phenomena to occur in any human being. Okay, it's not something rare, like you can say schizophrenia, or you can say mood disorder. It's something rarely to occur in a human beings, but anxiety is the commonest in you can say in general population as well as in a psychiatric ward or a clinic. You'll find this patient in a number of cases. Very routinely you will get these cases. So it covers around 20%. Okay, around 20% people on an average will suffer from anxiety symptoms. Second, you can see they have said something about fear. Now it looks like fear and anxiety are similar, but there is a mild difference. We'll be discussing about this. Okay, so let's understand one more point about anxiety is fear is a response to external danger, means outside danger, while in anxiety, the danger is largely unknown. So what is the difference between anxiety and fear? Anxiety is something internal, which you feel, okay, which you experience internally, okay, that is uneasiness and all, while fear is something external. You know something is outside and it is fearful. Like suppose there is a snake over here, or there is a spider or something which I'm scared. So that is fear, not an anxiety. But suppose it is an, what you can say, you know something is going to happen. There is an exam after some days. So you will be like, it is in response to future events. Okay, response to some stressor outside us. Okay, so it is like that's means anxiety is internal while fear is outside our body. We know there is exam approaching. So it is something stressor. We perceive exam as a stressor generally. So it's a reaction to that stressor. That is, you can say, fear. Okay. So next, the third point, if we cover here, is anxiety is a state of apprehension. Okay. Anxiety is a state of apprehension or unease arising out of anticipation of danger. We just already discussed about this. Is an anticipation, means you are predicting, assuming this something is going to happen, and mostly it will be negative. If something is positive, we call it eustress. Okay, this is something like a distress, negative event. So it is like we assume and it becomes uneasy. Okay, anticipation of some danger. Danger could be anything, like you are participating in some maybe bungee jumping or anything, it could be danger. Okay, outside. It's generally outside. Okay. And then the fourth point is anxiety becomes pathological. This is a very important term. Okay. Which significantly subjective distress and impairment in the overall functioning of an individual. So what does this mean? That it is pathological means it is something dangerous. It is something very, you can say, psychotic in nature. So it becomes dangerous. Anxiety is there in almost every individual. Just like there are 7 emotions, like there is something like excitement, that is happiness, sadness. Okay. Similarly, anxiety is 1 out of 7. It's not something different. Everybody has it, but it is called pathological or it is called disorder only when there is significant means larger quantity, or which is very much visible, which is very much obvious. Okay. When it becomes significantly significant and it causes subjective means personal, distress means something negative. Okay. So personally you are stressed, personally you are distressed. And impairments, it is disabling, means it is making you disabled, or it is making you not work or function properly. So your functionality is affected. So it is called impairment in the overall functioning of an individual. Overall means what? Overall means your all the major areas. Like for example, maybe you're doing some job, you are a parent, you have to look after your kids. Maybe you are in some social gathering, you have been given some social responsibility. Okay, everywhere. Okay, or even if you are personal, like grooming, taking care, brushing, having bath, this is your personal care. So even this is affected by anxiety. So this is like what I was trying to cover, like what is anxiety? This is an introduction to anxiety. Okay, so hopefully this is understood. So now we have discussed the definition, we have discussed the what you can say forms of anxiety, okay, and different symptoms of anxiety. Now we have also discussed what are the types that we are going to cover. So again I have put the same slide to let you know this. These are the things we are going to cover. The first one is separation anxiety. Separation anxiety disorder. So let's understand this. Separation anxiety. Okay. The first one. Now you see separation anxiety. What is the word that you get? Let's go word wise. Okay. Let's focus on a word, separation. Okay. Separation. What this word means, a general public can also say, it's like something getting departed, something is getting apart. Okay, so that anxiety. Now what is getting apart in a human being? Maybe some person, okay, some object of attachment is getting departed, okay, getting separated from the person. That anxiety is called separation anxiety. Okay, generally this anxiety has been observed in the kids from the beginning. Like for example, between the ages of 18 months to 3 years, it is more visible or more obvious in a kids. They generally feel separation anxiety when the mother goes out of the home, okay, for a work maybe, or she's gone in a kitchen to do her chores or routine work, and the child doesn't find the mom around. And since the child is not so aware that she can be in some other room, that awareness develops gradually in a kids. Okay, so because of that, the child may feel separation, or mother is going out for a job or for a long vacation or for any other reason. Okay, the child develops these anxieties. Okay, so disorder in which child become excessively anxious when separated from parents, generally between 18 to 3 years. Okay, it can be real and imagined. Second, children are especially prone to separation anxiety during the time of stress. Means it doesn't occur generally. The child must have been already in some sort of a stress, some sort of a tension. Maybe you can say maybe not happy with the caretaker, maybe not happy with the food or something. The child is feeling some pain in the body. So some stressor is already there, and child wants a mother or the primary caretaker, and that the primary caretaker is not available. Then in stressful situation, the child can feel separation anxiety more, okay, more prominently. Then separation anxiety differs from normal clinginess. Now we say the child has been clingy, okay, doesn't leave the mother. That is very much different from separation anxiety. This has to be understood very clearly. Okay, it's not normal clinginess. Child want to stick to the mother for all the pleasure. It's not like that. In separation anxiety, what happens is children can't think anything but the present of separation, and along with this continuous thought of separation, there may be nightmares. The children will have nightmares, bad dreams, okay. Then they'll have regular physical complaint like bloating, diarrhea, fever, okay. All these symptoms are psychosomatic. It's not that the child is actually suffering from some physical ailments or things. It's because of overthinking. The children can also do that, okay. And that is why this is how it is separate from general anxiety, or you can say normal clinginess. It's different, okay. So these symptoms are there, and over the period of time, okay. The next point is treatment includes talk, play therapy, possibly an anti-anxiety medication to the kids, and even to adolescent and even adult. Even adult and adolescent can have, or you can say have persistent separation anxiety in them because it has never been resolved, okay, at the right time. The next is DSM-5 diagnosis, okay. So when will you call somebody is having a separation anxiety? For kids especially, okay, or children, you can say they should have it for 4 weeks minimum. Consistently, they are experiencing these nightmares, physical complaints, okay, fear of separation, okay, reluctant to go to school, not attending schools or giving some excuses. So this has been persistent, and it is not normal clinginess. Then it is 4 weeks in children and in adolescent as well, okay. And for an adult, okay, for an adult, it is for more than 6 months. So separation anxiety should last in an adult for 6 months in order to diagnose. Okay, so because there are, in DSM-5, there are various diagnostic criteria to look upon. Okay. The next is selective mutism. Okay. So what is selective mutism? Earlier, this topic was identified as an autism. Okay, because many of the symptoms were looking like autism. Child is not been able to talk, means communication kind of an issue. But now recently in DSM-5, that has been moved to anxiety disorders. So it is no more an autism disorder. Okay, it's an anxiety kind of a disorder, and symptoms may look similar. So let's understand what is selective mutism. So selective mutism, also known as situational mutism. Okay, situational mutism means child or a person, any person, okay, will not talk with specific environment, specific people. Okay, they'll remain mute. Although they are capable of talking, they are capable of or talented enough to express what is going in their mind, but they'll not talk. Okay. Okay, so it is a situational mutism. While a person normally speaking, okay, normally capable of speaking or speech, cannot speak, okay, in a specific situation or to the specific people. So there are some people, okay, generally though are like those who have anxieties in their family. Okay, there maybe father was that way, mother, maybe any person in the family had anxiety related issues, and genetically it has been transferred. Okay, so even in my general practice, I get this kind of, it's not very common. Okay, it's a rare thing, but I had 1 or 2 cases when even the senior most person, the CEO of the company, okay, in present of some other equivalent kind of a person, okay, could not speak properly. It's like he had to explain his target or whatever his plan was, but there was some equivalent person from some other company and this person was not able to express. Similar things is to happen to him in a school, okay, with one particular teacher, and similar thing is to happen with one of his uncles as well, when with that particular, because that uncle was very much sort of finding out faults in the person. Okay, the teacher also according to him was finding faults, and any person who he has like assumption that this person will find faults in my job or faults in my thing, he'll get mute. It's like selective. He selects to be mute in that particular situation. Okay. Second point, selective mutism best understood as a childhood social communication anxiety. Okay. So it is generally seen in kids, in childhood, in school and all. Third, selective mutism is a social anxiety disorder, most commonly found in children and often mistaken and misdiagnosed as autism. You know what is autism? So autism shows triad of a symptom, okay, like socialization, communication and repetition of activities. Okay, they'll do same thing. So very much the symptoms of selective mutism mimic autism, okay, but still it has been identified as a separate disorder. Okay, on the surface, some of the characteristic may mimic autism behavior. As I already said, it looks like the child is autistic because he's not talking, not communicating, and in specific situation. But you have to do proper diagnosis for that. Okay, sit down with the selective mutism separate diagnostic criteria and autism ka separate diagnostic criteria, and then you can see how it is different, the both thing. There is a vast difference between these two disorders, since they commonly appearing symptoms may be same. Okay. The third one is specific phobia. Okay. Now let's understand the term itself. Specific. Okay. So it is very much particular, not random or not generalized. So it is very much specific, and then something called phobia. Now what is phobia? Phobia is an irrational fear. Okay. Now what is meant by irrational fear? Irrational means something which is not logical. Okay. Even if you think on a particular sequence of events, it turn out not to be so logical. Okay. Let's understand this. For example, the first one, specific phobias. One develops fear of new places, okay, high bridges, elevator, animals, snakes, dogs, okay, aeroplanes, thunder, dental or medical procedures. So they are very specific. A person will not have all of this, okay. One person, suppose a person will have, maybe he's scared of high bridges or he's scared of elevators. Some people may be scared of only spiders. Okay, they may not be scared of any other animal or insects. Okay, some may have fear for only medical and dental procedures. So it's very specific. That is why it is specific phobia. Okay. So, and even the public transportation and other things. The next about specific phobia is it's irrational. As I said, it's illogical. Okay. You don't have to actually engage in an activity. Actually, even when you are not into an actual, suppose I have fear of heights. Okay. And I don't have to be on the 100th floor or some Burj Khalifa to experience this phobia of height. Okay. Even if somebody tells me, I'm going to Burj Khalifa and you have to come with me. Okay. And then with the thoughts itself, I have not been there. So somebody have asked me to come with him. That means I'm already gone. So imagining that, I made a sequence of event. I already reached there in my imagination. Now I'm sweating. Okay. So this is like, you don't have to actually being there. The thought of being there of your specific phobia is enough for give you anxieties. The next is, these phobias can disrupt your daily routine. As you know, any anxiety can disturb you from your daily activities. Okay, taking care of yourself, going to job, doing your routines. Okay, limit your work efficiency, your self-esteem, the confidence level that you have will go down. Okay, because of anxiety. There is a direct relationship of anxiety and confidence level. Okay, if the anxiety is high, confidence will be low. Okay, and the confidence is high, the anxiety will be low. So generally people who suffers from anxiety do have lower self-esteem and confidence. Okay, then put a strain on relationship because they usually try to avoid situation at any cost. Now suppose you are in a relationship, it's a give and take, you have to share things, and you have a specific phobia, suppose. Okay, like you are going out of country and you have to take a plane, but you have a specific phobia of a plane, then your trip is haphazard, like you won't be able to cover it within the time or something. So this has been affected. The next point, okay, some are developed in childhood and some arise unexpectedly. Now, how is that? We can understand that phobias are developed in childhood. Like suppose in neighborhood of mine, there was a dog, and after seeing it, I used to get scared. I used to run faster than the dog, and the dog used to follow me. Okay, so this is like something has arisen in my childhood, and it may be still there. The second is it arises unexpectedly. Now, what is this unexpectations? This is because this relates to something called our conversion disorder. Conversion disorder, this is sort of a, you can say, psychosomatic issue. Okay, when person experience this conversion disorder, that is mental stress getting converted into our bodily stressors. Okay, a person can do or loses multiple functionality of himself. Like for example, a person can lose his memory. Okay, a person can become blind, a person can become paralyzed. Okay, person will be even mute or unable to talk. So all this can happen unexpectedly because you are suffering from another disorder, and that disorder is because of your extreme stress. Extreme stress means stress which you cannot handle, because every individual has a threshold level to handle stress, and when it exists our threshold, it leads to sort of an anxiety and even anxiety related disorder like psychosomatic disorders. And the fifth one is it impact or include cognition that leads to behavioral response whether or not threat is present. Means now the anxiety that you suffers from, okay, whether it is specific or not, the anxiety has the chances to become spiral. Okay, anxiety, like you start getting anxiety of an upcoming anxiety. So that is an anxiety spiral. Okay, it covers you up. Okay, so even when the threat is not present, your chances are that you're going to get anxious and feel like or get all these physical symptoms and psychological symptoms. Okay, so this is so far about our third specific phobia. Next, we'll see some of the treatments of these phobias because they are irrational. So mainly, which generally we use treatment for phobias are systematic desensitization. So it is like in vivo and in vitro techniques are used. Okay, flooding is mostly not used. It is not recognized, but earlier times this is to be used. Okay, with or without relaxation. Then modeling. Okay, and then cognitive restructuring, skill training, and gradual exposure to the fearful stimuli. Okay, and some people, okay, also use hypnosis and medication for specific phobias. The next is fourth is social anxiety disorder. Okay, now as you know, social anxiety means you're anxious in the social environment. Okay, so let's see, it's also called social phobia. Okay, so social phobia here is an extreme fear of being scrutinized and judged by others in a social and performing situation. Okay, so wherein you have to perform in front of maybe people, can be 4 people or 100 people. The specific this is social anxieties relates to like person feel being scrutinized, that he has a feeling that I am special and everyone's attention is on me, and he get, or you can say, very much cautious about it, and then he thinks that other people will judge me for what I'm doing or how I'm speaking. Okay, in any of the social and performance situation, irrespective. Although they recognize the fear has been excessive, it's too much, they are aware. Okay, it's not a psychotic. Anxiety disorders are not psychotic wherein you are not aware. So you're very much aware this fear is been excessive, कुछ ज़्यादा हो रहा है. Okay, फिर भी they are and they are excessive and unreasonable, but people with social anxiety disorder feel powerless against their anxiety. Means they feel, I cannot handle it. I know this is like speaking in front of 3 people is nothing something special. Okay, but they feel, I cannot handle it. Okay, I won't be able to do it. I know it's too much, but it's okay. Then they are terrified that they will humiliate and embarrass themselves. So what they do, they avoid any social gatherings, any social events, okay, or maybe even small get together. They may try to avoid because they have tremendous fear that people will judge them, people will observe them, all the attention will be them, which is very much irrational. Okay, example would be, which situation it could be? It could be public speaking, attending parties, starting a new relationship wherein you have to initially show your personality or try to be, what you can say, give a first impression. These people will be better not to start any relationship, like avoid them. Okay, then academic situations like examinations, upcoming of a result, okay, perhaps interviewing for a new job, a more pervasive and highly cognitive kind of a phobia. So more pervasive means something which has chances of getting impacted, like it is going to get severe, and it's something called having multiple symptoms altogether. So this social anxiety disorder is something very pervasive. It covers major areas, and the person will avoid them at any cost. Okay, the next, with specific people or with anyone who we perceive will judge us as we consider them as the center of attention. So we feel we are at the center, which may not be with everyone. Like, as you just imagine, not everybody is interested in you and everybody's interest like focusing only on you. They have their own work and their own things to do. But these people tend to feel that they are center of attention. Okay. And this social anxiety, okay, you may feel this is very much common to introversion. To people who are introvert is similar to social anxiety. It is not so. Okay, this is a very much big myth that people understand. Okay, so how it is different? Let's understand. Social anxiety is people avoid social gathering or people or situation where there are large number of people and they have to speak in front of them. Okay, this is social anxiety. While a people who are introvert, okay, may not have social anxiety. They are fine if there are 10 people, 20 people, 100 people and they have to speak. But they are more comfortable in their own zones. They are comfortable staying alone in their own interesting place and with whatever they want to do. So this, as we see, there is a difference between social anxious person and the person who is introvert, how they are different. So this is like the person with social anxiety wants to mingle, wants to talk, but scared due to past experience or fear of rejection. Because in the past they may be rejected, somebody pointed out faults in them, okay, scrutinized them and did many things which was not pleasant. Okay, so they are now fearful of them. Okay, separate from introversion, as they themselves do not want to mingle. They like in their own space. They like to be alone and they enjoy their own company. Okay, so that is the difference.